Now, as the Delta variant surges across the country, nearly 99% of the COVID patients in Virginia hospitals who were infected, hospitalized, or even passed away were not fully vaccinated. And our Prime anchor, Lindsay Davis, actually spoke to a patient, Travis Campbell, a resident of Virginia, who is now among those in the throes of battling COVID-19, not even able to leave his hospital bed. Well, he is using every breath he takes to urge all of us now to get vaccinated. Take a listen to the interview.
Travis, we see you there with the oxygen mask on. Just want to start out by asking how you're feeling.
I'm making it. It's a fight. And you think you have to fight for your life. You don't realize you're fighting for every single breath all day long. It's tough. This is a very serious strand. The Delta is more aggressive, and it attacks those that have issues and that have not been vaccinated.
And Travis, as you say, it's a fight just to talk and get every breath out. Why was it so important for you tonight to use that breath that you're struggling to get out to talk to us?
If I have a day or two left, I don't want to waste my time. I want to help as many people as I can to let them see the real truth, that it's real, and it's only getting stronger and faster, and it's very important. I would rather be covered and protected.
Kelly, I'm told that you were also hospitalized with COVID and two of your children were also infected. Would you say that the virus is more dangerous than you and your family initially thought?
Yes, we did. It hadn't been close to us, so we didn't know the great depth of it until it hit our family.
And Kelly, you're in an area that, according to recent data, is extremely high risk, though. Neither of you got vaccinated. Why did you opt not to get vaccinated?
It wasn't that we were against it. We heard you'll probably still get it, or, everybody talks, but we just put it in the back of our mind and kept saying, we'll go tomorrow, we'll do it tomorrow. And we have a very busy life, and that is no excuse, but that's our excuse.
Out of sight, out of mind, and COVID started going away. So you kind of think about it's past you, and you may have beat your odds. But now with this new Delta, everything's changed, and it's stronger than it ever was.
What's the prognosis for you, Travis? What are doctors telling you?
To fight. They're doing everything they can do. Next step would be a chest tube, breather, ventilator. My main concern is I want my friends and family to understand that if you get this Delta variant, that's not the real problem. The real problem would be you finding a bed and you finding somewhere that can help you, because it's just like a fish out of water. You can't breathe. You're going to suffocate, and it's miserable. And I beg you, please see your doctor and make an evaluated decision and protect your family or prepare yourself for your next phase of life.
Now, if that does not speak to you, I don't know what else could. Riveting and a true reality check. Our thanks to Lindsay Davis and also to Travis and Kelly Campbell for that interview. So grateful. And for more on this devastating Delta surge, I want to bring in Chancellor Cam Patterson of the University of Arkansas Medical Systems and Medical Director at Baylor St. Luke's Emergency Center in Texas, Dr. Rashina Bousset. Thank you both for being here. And I'll get to what's going on where you both are shortly. But first, I just want to get your reaction to that interview that Lindsay Davis did with Travis Campbell and his wife, Kelly, from the hospital. Chancellor Patterson, let's start with you. I want to start off by just getting your reaction to that interview. And also, what do you make of what we're experiencing right now? I mean, that really is the first time, at least I have seen an interview with a patient on oxygen from his hospital bed telling all of us, please don't make the same mistake I did and get vaccinated.
Well, it breaks your heart, doesn't it? This is a family, young kids, and, devastating, potentially fatal problem. And you know what? It also makes you a little bit angry, too. It makes you angry that there's so much misinformation that are leading people like the Davises to make bad decisions. So this is an avoidable problem. It's an avoidable crisis. And right now, it's a disease of the unvaccinated.
Dr. Bousset, how did that interview move you?
I think my feelings on the situation are pretty complex because it is very difficult to watch as a physician. I know that he feels as if he's drowning in his own secretions and is having a hard time breathing. He couldn't even speak a full sentence without having to pause and take a breath. But at the same time, it's difficult to combat some of the negative feelings that come up when you wonder why people are putting themselves into this kind of predicament when we have vaccines that we know are safe and know are effective. We look at our leaders and we expect them to lead us to do the right thing, and that's not what's going on right now.
Now, as the Delta variant spreads across the U.S., Texas has reported more than 19,000 new cases and more than 7,000 hospitalizations and cases there have soared 92% since last week, according to the Texas Department of State Health and Services. And then over in Arkansas, there are only 25 ICU beds available in the entire state with more than 20,000 active COVID cases. And that's according to the Arkansas Department of Health. The governor is even trying to reverse his ban on mask mandates in schools, which he said he regrets approving. So, Chancellor Patterson, in Arkansas, there are only 25 ICU beds available in the entire state. So how dire is the crisis there, and what are Arkansas ICUs like right now?
The ICUs are full. We're putting patients who require critical care in non-ICU settings like the recovery room at times. And what's even worse is that we have patients in small rural hospitals across the state who are in emergency rooms who need ICU care, and there's no place for those patients to go. The system really can't bend that much more at this point in time.
And Dr. Bousset, North Texas is seeing hospitalizations reaching the highest since mid-February. So what are you seeing at your hospital, your biggest concern?
I think we're watching a hospital system that is on the brink of collapse, not just in Texas, but in multiple states across the U.S. On Monday, it was reported that Austin and Travis County only had 7 ICU beds available for 11 counties that house 2.3 million people. Here in the Texas medical centers, our ICU beds are full. And while we do have a little bit of surge capacity, even when you consider those surge beds, the phase 1 and phase 2 ICU beds are still 84% full. This is not just for COVID patients. If you come in with a stroke, a heart attack after being in a car accident, there are no beds to take care of you. People have got to take heed.
And Chancellor Patterson, the governor of Arkansas, says he regrets approving that ban on mask mandates in schools. And you're seeing an influx of young patients now in your ICU. So what are you worried about the most as the school year gets underway?
Well, there's no way to have a safe in-school environment if kids aren't masked up and socially distanced. And we've already seen in Arkansas 2 outbreaks, one in the governor's school and one in public schools in Marion County. 500 kids are quarantined in Marion County because of a COVID-19 outbreak that occurred as soon as school opened back up. So we have to make sure that we keep our kids safe. We have to realize that with the Delta variant, kids go to the ICU. Unfortunately, COVID-19 complications can kill school-age kids. We don't want to see that happen. If we have multiple outbreaks in public schools across the state of Arkansas, an already distressed healthcare system is going to be broken.
Wow. And Dr. Boussette, according to the White House COVID-19 response coordinator now, 1/3 of all U.S. COVID-19 cases reported in just the past week were in just 2 states, Florida and Texas. So how does Texas come back from this? And how much does the vaccination rate need to rise for cases and hospitalizations to actually decrease?
You know, Kara, since the very beginning of the pandemic, Texas has actually feared in the top 4 states in terms of number of cases, number of hospitalizations, number of deaths. We have not at one point gotten this pandemic under control in our state. Right now, we have about 44% of Texans vaccinated. That's not enough. Although children under the age of 12 are not eligible for vaccine, that only makes up about 17% of our population. So if every adult did what they had to do in order to get vaccinated and get their children vaccinated, we could still achieve herd immunity to get things under control in our state.
Wow. Well, Chancellor Patterson, there's even an Arkansas hospital that is so short on nurses. Apparently, it's offering a $25,000 signing bonus. So how exactly overwhelmed is Arkansas hospitals, and what resources do hospitals really need right now at this moment, in your opinion?
Well, our human capital is our most precious resource. Our nurses, our frontline caregivers. We currently have a couple of hundred frontline caregiver vacancies. We have jobs, but we don't have people to put into those jobs. It's causing us to increase our nurse staffing ratios. A nurse who used to care for 3 or 4 patients may be taking care of 6 or 7 patients. Nurses are working 12-hour shifts 5 or 6 days in a row. This is unsustainable. We have an A-level team here at UAMS. When the pandemic first started, we were in the first quarter. Our team had a lot of energy. When this third surge started, our team was in the fourth quarter, and now we kind of feel like we're in double overtime. So it's difficult, it's painful, it's emotional, and I am extremely concerned about the resiliency of our team if this continues for months and months.
Well, I hope folks see this interview and those jobs get filled and you get the support that you need. We sure appreciate you, Chancellor, and also Dr. Boussette, for talking with us today. And the word needs to get out, no doubt. Thank you.
Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.